And my name is Loveth Onyebuche on Red Hot. In the studio with me today is an expert, an epidemiologist, a senior lecturer with Alex Ekweme Federal University College of Medical Sciences. Thank you for joining us on the program, Doc. I'm glad to have you.
Thank you. You're welcome.
Thank you and welcome to the program. And today we want to look at prostate. I've had a couple of people around me complain about it. What got me interested in this is the fact that it is in our body. So I want to get a clearer picture on what this prostate is, where it is located, how it can be affected, and all of that. These are the things we want to look at. But let us even begin by telling the people what prostate is.
Thank you very much, Loveth. I'm here to discuss this matter because prostate health, diseases affecting the prostate, is a very serious public health issue. It's of public health concern, and that's why I'm here today as an epidemiologist. First of all, we'll say, what is prostate? Prostate is a small gland in the male reproductive system. It is located in the perineum. It sits in front of the rectum and around the neck of the bladder. The prostate is just a small gland made up of glandular tissues and connective tissues. It is a small gland that is almost about the size of bitter cola. It's as small as that, or almond seed. But it starts growing bigger than its size when a man attains puberty. And the prostate itself, it has 5 lobes. We have the anterior lobe, that is the one in front, the posterior lobe, 2 lateral lobes, and the median lobe that sits around the neck of the bladder. It has good functions because God is wise. Any organ that God puts in the human body has its own function. This prostate gland secretes fluids that helps to nourish the sperm and helps in transporting the sperm when it is released from the testicles through the urethra during ejaculation. And it equally helps, because of the contractions of the muscles of the prostate, because of the location, equally helps to push, even when urinating, to expel urine through the bladder, from the bladder through the urethra to the outside. But it equally has problems associated with it. At early stage of, it's only found in males.
Okay.
It's the male reproductive organ.
All right.
It is only found in males. So as one attains puberty, the prostate begins to grow in size. It can reach the size of a lemon, this fruit, small oranges, as it's growing. And as it is growing, it can equally, because of also unknown factors, lead to what we call prostatic gland enlargement, which we call BPH. That is when the cells of the begins to grow number above the normal size. And when it begins to grow more than it should be, it will now begin to put pressures around the neck of the bladder.
Okay, so what can actually lead to this growth?
No, like I said, it's a normal physiologic process.
Okay.
As the man is growing from puberty, it begins to grow in size.
Okay, so growing does not imply being unhealthy.
No.
Okay, so it's normal for it to grow.
But in some people, because of there are hormones that affect the growth of the prostate glands.
Okay.
Because of as one gets older, then it keeps growing in size. That in 60% of men, it will grow into prostatic hyperplasia. That is the BPH, benign prostatic hyperplasia. Benign in the sense that it is not cancerous.
Okay.
It is not cancerous. But the only thing is it has problems associated with the benign prostate hyperplasia. The reason is that when it grows beyond that normal size, it begins to put pressures around the neck of the bladder.
Okay.
Then the bladder is no longer able to fully empty the urine. That is why it begins to put pressure. Then the males will start experiencing some symptoms because of the increased growth of the prostate gland around the neck of the bladder. The major symptoms men will begin to experience at this level is that he is now, that's what we call increased urine frequency, especially at night. The man will begin to wake up to go to urinate because the bladder is always all the time half full because he's not unable to fully empty the bladder.
Okay.
Then there's equally what we call urgency. As he's going out to, he's rushing. It's like the urine is about coming out on its own. There is urgency. Then when he goes to urinate, as he wants to urinate, because of pressure, the urine is up. It is difficult for the urine to start coming out.
Wow.
Yes, yeah, especially when he tries to put pressure, the urine will not come out. Or until he relaxes, it will now begin to drop. And the stream of the urine will no longer be straight. It will now be dribbling. And that will equally lead, like I said, there will be a kind of feeling of wanting to urine all the time because the bladder is unable to completely empty the bladder.
Okay.
Even after going to urinate, after a few minutes, he wants to urinate again. Then because of the increased volume of urine retained in the bladder, there's tendency for bacterial infection.
Okay.
And when there's urinary tract infection is now a problem amongst men who have developed these symptoms of BPH. So many of them are prone to bacterial infection, and that will now possibly lead to prostatitis, that is inflammation of the bladder walls. And that is equally has its own symptoms, which is most of the time the symptoms of urinary tract infections. Then most of them, they begin to feel pains around the penis, in the scrotum, in the lower abdominal region, even at the lower back. Some we even experience complaint of pains even in the chest. These are the symptoms of BPH. And like I said, there are problems associated with, we have BPH, we have prostatitis. But the greatest concern about this issue of prostate is when we talk about prostate cancer.
Okay, that is where we are.
And that is the major concern. That is why we are here, mainly. Because prostate cancer is the most common cancer amongst men and second highest killer of men in cancer-related deaths after lung cancer. It's as bad as that. And it's like the rate is increasing. It's increasing. That's why it is now of public health concern. That is why we are here. So when do men develop, and one problem about the prostate cancer is that it is so slow-growing cancer. When the cells of the prostate begins to multiply abnormally, out of control, and that is where cancer sets in. And because it is slow growing, most men don't experience symptoms at the early stage of this cancer. And that's the danger about it. It takes time to grow without showing signs. And but by the time it will show signs, now when it has started spreading to nearby organs and other parts of the body. And that is why it is very, very dangerous. So like I've talked about, BPH, which is benign enlargement of the prostate.
So at this point, if one is going through such a health challenge,
yes,
what is that person required to do?
Yes, that's what I say. When you begin to have any sign or symptoms of any disease in your body, the first thing is to seek medical attention from health experts. Don't go to start drinking herbs.
Over the counter.
Don't go to buy drugs over the counter, because you may be treating one thing while the other thing is that you are suffering is a different thing altogether. Like I said, this urine presentation, frequent urination, and all those things, so some may think it is a simple UTI. Some will think it is diabetes mellitus, while the problem is prostate enlargement. Because these are the ones that present symptoms. You want to rush to go to urinate. When you go there, the urine is not coming. You have to relax before the urine will start flowing. Again, some of them may equally have outright urinary obstruction. The person wakes up and he's unable to urinate, and the bladder is full and is pain. This is almost a surgical emergency. When a man, especially after an alcohol binge, maybe he drank a lot of alcohol in the night, slept off. In the morning he wakes up, his bladder is full, he's having pains in the lower abdomen, he's unable to urinate. It's a very painful experience, and that would need urgent surgical intervention, about through passage of urethral catheter or perforation of the bladder so that urine can come out. So if that one has a problem of
okay, so does any kind of food or whatever behavior predisposes one to
yes. So most of these things, lifestyle, the kind of food we eat, exercise is very, very important. They're hereditary, but that is commoner for those who have cancer of the prostate. For one whose father or from grandfather had cancer of the prostate is equally likely to have it. And that is where hereditary comes in. And that is why screening is very, very important. Screening once, like I said, the prostate starts to grow from the 40 years and above. But it starts growing at puberty, which is from 18 years, it starts growing slowly in size. But above 40 years, that is where most of those who come down with BPH present symptoms. And that is why regular screening is very important. You have to go for a check. When you go to the hospital, a doctor will use gloved hands, lubricated finger, and place into the rectum to examine, because like I said, the prostate is located within the perineum, between the rectum and the bladder. So when you put your hand around, you'll be able to feel the prostate. For the normal ones, it will be smooth and soft or firm. But if you put your hand and you feel it and it is hard, that you are feeling bumps and it is hard, you are likely dealing with cancer of the prostate. And that is why screening is very important. It's not just only about the clinical examination. There are other investigations you need to do. There's a particular protein the prostate secretes, which we call prostate-specific antigen. So, and this, you collect blood, you check for this protein antigen in the patient's blood. If it is raised, most of the time it is raised very high in cases of cancer of the prostate. But both in BPH and in prostatitis, that inflammation of the prostate, then it could be raised, but it will not be as highly raised as that of when it is cancerous. So that is equally very important. So screening is very important, so that you'll be able to, even if you check it at least 2 to 3 years, after every 2 to 3 years, you recheck again. So that you do, because it's easier to dictate. If you dictate, especially if it is cancer of the prostate, if it is detected early, management is much, much more successful. Prognosis is better. But if you detect it when it has already spread, affecting other organs, it is difficult, and that's why Doc, it is a major killer of men.
Okay, so at this point, while we are talking about cancer of the prostate,
yes,
how does one feel immediately that it gets to that stage of cancer? It becomes cancerous, because, you know, when you talk about the BPH, yes, the urine issue and all of that, the pain and all of that, so when it gets to that stage of
when it gets to that stage, like I said, the patient becomes generally unwell. Patient will begin to lose weight.
Okay.
The patient will begin to feel pains at the lower back, around the perineum, like I said, even in the chest. So the patient, but the major thing at that period is that patient is generally unwell. There's weight loss, because that is one of the common presentation of cancer. Cancers, you begin to lose weight abnormally, even when you think you are eating well. And patients will equally begin to lose appetite for food. Anorexia will set in.
Okay, does it present itself through the penis?
Yeah.
Because we know that when we talk about cancer of the breast,
yes,
when it gets to that stage where the cancer, you say it presents itself around the breast,
yes,
because you're going to notice an abnormality, yes, around the breast. So, yes, is it going to affect the
That's
male
what
organ?
I said, because it's the breast. When it is a breast cancer, it is affecting the breast, which is an organ.
Okay.
When it's prostate cancer, that's why I say when you examine as a doctor, you put a gloved finger, index finger, lubricated into the rectum. You are going to feel the prostate.
Okay.
And when you feel it, if it is a normal enlargement, you will feel it, but it will be firm, it will be soft,
Okay.
it will be smooth. But when you feel it and it is hard and bumpy, that means
There's a
really,
problem.
you may be dealing with a case of cancer of the prostate. And that is why I say the next thing you do is that prostate specific antigen. You have to check for that protein. And in that case, most of the time, almost all the time, the PSA will be raised. You need to still do other investigation. You may now need to do what is called biopsy. You use a pin, needle to you can go through the penis, so that you now pick a sample from the prostate, which will be taken for histology, and that is what will confirm that you are dealing with a case of cancer of the prostate. So the way the breast cancer shows in the breast, the same way it equally presents itself in the prostate gland, that organ where it affects.
Okay, but
So,
because it's not seen,
because
so you
it's
may
not
know
exactly,
if it's
but the doctor will feel it, because it's only a doctor who knows where it is located. And knows how, where, like I said, it has 5 lobes: the anterior lobe, the posterior lobe, 2 lateral lobes, and the median lobe. The one is at the middle. And this medial lobe is the one that pinches at the neck of the bladder. So many times when you are talking about BPH, you equally talk about management. When it is not cancerous, you talk about management, and the state of management most of the time may be surgery, prostatectomy, that is remove the prostate itself.
Wow. So if the prostate is removed,
Yes.
can the man still function?
Yeah, but
Properly.
it still has its own problems, because like I said, the prostate has a purpose. It helps, including erection, it helps men. And like I said, it secretes this semen, this fluid that equally helps to nourish the sperm that when and carry, and equally is a medium of transport. It's a whitish, milky whitish fluid that you see in, that is what we call the semen. So the seminal vesicles and this prostate gland secrete this fluid. And this fluid from the prostate gland contains enzymes and citric acid that equally helps to nourish the sperms, so that it will be healthy and be able to fertilize an egg. And that is why some of the men will have problems of impotency when the prostate is no longer functioning. And then what we equally call erectile dysfunction. The man may no longer be able to achieve full erection when there's a problem of the prostate. Yes.
All right, so at this point, Doc, let's look at even the people that are at risk.
Yes.
Because you know that this is men-related issue.
Yes.
Okay, so at what age
Yes.
do you advise young men to be more careful?
You get to 40, you are at higher risk
Okay.
of developing BPH. Like I said, 60% of all men will likely experience it in their lifetime.
Okay.
But for almost all men, there's this gradual growth of the prostate.
Prostate.
So, but there are equally hormones, especially the testosterone, that help secreted by the testicles, that equally affect the growth of this prostate gland. So because of that, that's why most of the time when you have CA prostate, you see that the part of the management will be to remove the testicles.
Okay.
Because when you remove the testicles, these hormones, excess hormone that is increasing the multiplication of the cells, will no longer be there. That is equally.
But when the testicles are removed,
But because like I said, that is, remember there's equally one thing, like I said, it comes at late stages of life, later
Okay.
stages of
Okay.
life. So at that stage, most of the men have finished their childbearing.
okay.
And that's why it's equally advised for young men to try to marry early.
Okay.
When you marry early, so that by the time these problems are
You already have your
you
offspring.
have your children that will be helping to carry you around.
To tell you sorry.
And not when you wait until retirement before you begin to go to look for
Marry.
small girl to marry.
Okay.
When you marry a small girl, when you're already 60, then at that stage you're having problem of erection, that is erectile dysfunction. You have these problems and all those things. So definitely the girl, most of the time the girl will not be able to stay.
Okay.
So it is, like I said, this happens from 40 years and above. 60, 70, these are where it is commoner.
Do we really have awareness about this?
Yes, what we are doing is
how
part
much
of the awareness.
sensitization, apart from what we are doing here?
Yes.
Because when we talk about women issue, maybe we talk about the cervical cancer.
Yes.
Now, it's as if the government is actually pushing hard and spreading this information and trying to help the women to manage their health in that regard. So do we have such sensitization help, for men?
Yeah, that is the problem we have as men. Men are usually marginalized.
Wow.
In the scheme of things. If the prostate cancer were the problem of women, in fact, every radio station would be announcing it, the measures to be taken every morning.
Maybe because you had the week after.
Everybody will be on it. Unfortunately, is that many men are carrying this problem, including those who are putting on a urethral catheter.
Wow.
Because of it. But they are not telling people. Many men who are experiencing this are hiding it. Some are taking herbs and all those, and this will only increase their problems. That is one thing again with women. When a woman has, even if it is a boy, she will be shouting, I have this problem. Everybody will contribute to solve it. But for us men, most of the men will hide their problems. Like I said, lifestyle is important. Like I said, those who are predisposed to these problems, those who drink a lot of alcohol, they are more disposed to it. Smokers and those who use tobacco products, including smoking, snuff, and all these things. These are predisposing factors, and it is common amongst men.
Okay.
So, but like I said, we need to do more sensitization so that we know that this is a problem. Many a time when this comes, people think it is witchcraft.
Yeah.
And this is another problem. Then some will begin to go to chemists and other places, and even to prayer houses. There are ones that prayer solves all problems.
Yeah.
But there are ones that you must follow the process, because there are natural laws. And if you don't follow the natural laws, you may not get it right, no matter how I believe in the efficacy of prayers.
Yeah.
But most of the time, people will be praying, but if you don't remove that thing that is there, it's only that God will only help you to direct you to people who will be able to solve the problem.
Yeah.
To present your destiny helper where your problem will be solved.
If government should come to ask you now at this point, what do you want them to do in respect to this? Can you advise government in that?
One thing, like I said, prostate problem, prostate enlargement, prostate cancer, even prostatitis is of major public health concern. Almost every family has an adult male that is above 40 years. And this adult male that is above 40 years is a potential candidate for either BPH or prostate cancer or prostatitis. And that is why everybody should be involved. We should be able to sensitize ourselves and be able to look at our lifestyle. Is very, very important. Like I said, lifestyle plays a major role. The kind of food we eat, those who live sedentary life, who don't do any form of exercise, they are more prone to having this. So when you tell people about exercises, many don't understand what it means. Exercise is very important. Then the use of alcohol, some people are taking a lot of, they think it's enjoyment. You are gradually killing yourself. Then the same thing with tobacco, smoking, and all those things. When you talk to somebody, they say, Afro man must die of something. But
something must kill him.
But the biggest problem is that the agony your family will go through within that period of sickness. When they will be taking you from one hospital to the other and all those things. And these are things that we can avoid by the kind of lifestyle we live. Like I said, for those who have family history, it is important you start going for regular checks, screening, like I've talked about. From time to time, you go to hospital, they will check you and all those things. Check out that PS, the prostate-specific antigen, so that if it is raised, we begin to look at what is causing it. That rectal examination, the doctor will be able to know when it is ordinary prostate enlargement or where there's a problem associated that we are maybe dealing with a case of cancer. Then if it is prostatitis, like I said, that is causing the urinary symptoms and all those things, when you go to hospital, the doctor will be able to place you on the appropriate antibiotics if it is bacterial prostatitis, or if there are other inflammatory, then there are drugs that will be given that will be able to relax the muscles of the prostate, so that at least the passage of urine will be urine passage will be better, and all those things. You live a healthy, normal life with it.
Okay, so what are you asking the government to do in this aspect?
What I am asking government to do is that we should increase awareness. Okay. Awareness. And again, like I said, we need to continuously train and retrain our health workers, because most of these cases are happening in the rural areas. We have our health centers. Even in the health centers, those working in the health center should be able to make proper diagnosis, clinical diagnosis. Even if they will not do some of these invasive investigations and do like biopsy and all those things, but they should be able to properly examine a patient when the patient comes to the clinic with these complaints, that if you do rectal examination, this is what you are going to see. And again, so many men, because they feel uncomfortable, I've seen cases, somebody will call, you want to examine him, there they are, once you want to put your finger, he will jump up. He doesn't want it. He thinks he's discomforted. But this is something that is a matter of life and death. Yes. Because if we make this early diagnosis, then almost all cases, including this cancer, we can manage it, you live your life. Like I said, if it is a confirmed case of cancer, when it has not spread, then all you may need to do is to remove the prostate, you remove the test that is producing hormone that will equally increase the chances. And a man can live his life. You manage him like we manage diabetes or hypertension.
Okay. All right, you've been listening to Dr. Chris Archie. He is an epidemiologist and a senior lecturer with Alex Ekweme Federal University here in Abakaliki. Thank you very much, Doc, for coming on the program, and you've heard it. Your lifestyle matters so much. Be careful the way you live your life, young man. Alcohol, tobacco, cannabis, and all of that. When you are aging, all of this begin to show up, and it shows up in the wrong way. And of course, it's going to affect you health-wise. It's going to affect your economy. It's going to affect the peace and the happiness of the family and everyone around you. It's generally going to affect our society. So it's better we be careful how we live our lives today. When we are aging, we'll be happy and age happily. Thank you very much, Doc, for coming around to the program today. And my name is Loves Onyebuchi, and of course, Dr. Chris Archie has been the one in the studio doing justice to prostates. Thank you for joining us on the program today. See you again in our next edition. My name is Loves Onyebuchi, and before we meet again, stay healthy and be careful with your lifestyle.